All right. So let's get tucked into our first session, which I might biasedly be very excited about, you guys. Our first session today is Obesity is Not a Behavior, Lived Experience in Comprehensive Obesity Care. So joining me now will be Dr. Ian Patton, who Mary just mentioned, as well as Lauren Gaetz. Um, both Ian, Lauren, and I, all three of us are passionate patient advocates, and we're really excited to just kind of have a conversation together in front of everyone and share what it's been like in our perspective and from our experience of navigating seeking obesity care. What's that looked like? How did we manage all of this? A whole bunch of things are going to come together. So let's bring them on and tuck into our first session. Hello, lovelies.
Hello.
How's it
Hello.
going? Love this. All right. I am so excited about this, and I'm pumped that we get to kick off the conference today. A, because as the three of us know, we could talk about this for quite a while. We love these conversations. And B, I think we all have really unique experiences and perspectives as it relates to obesity management and kind of what that's looked like. And that might sound really simple and obvious that three different people would have three different experiences. But I think that's a really important part to reflect on. For so long, at least for me, diet culture was a lot louder than the science. And to me, losing weight just was the answer to obesity. That's what I believed for many, many years. Move forward to, okay, just go and lose that weight, eat less, move more. You got this. Felt like a real universal truth that was often splattered all across the news or what I've heard from so many different facets of my life. But I kept failing at that. And to me, that was squarely on me. And that was a really isolating place to be. So, while I kind of thought those things were universal truths, I kind of think they're now universal lies. I understand this is a really complicated disease that can't be solved in a headline. And really, it's a really unique and personal solutions is part of the conversation. So that's what I want us to kind of tuck into. But let's start by having you guys introduce yourselves. I'd love to hear from each of you kind of how Obesity Canada came into your lives. And then maybe as well, if we can kind of pontificate and think about what is like one thing that we really would like people to take away from today. So let's start there. And Lauren, if you're comfortable, I'd love to open up with yourself.
Sure. Thanks, Lisa. So I've had some similarities in my experience to you, and I'll summarize that as a lot of internalized weight bias. So I truly thought that, I was born in a larger body. I will always be in a larger body. It's my fault, and it's up to me to starve myself or overexercise or just sort of beat myself up until I'm thin. I've dealt with, weight fluctuations of gaining weight, losing weight, eating disorders, things like that. And I just thought that this was the roller coaster ride that I would always be on. And I really, truly wanted to get off, but I didn't think it was possible. I just thought that was the way it was going to be for me. I had, gone into medical appointments seeking help, and I had been met with the response of eat less and move more quite a few times. And so I really did believe that it was my fault and that it was within my control and that I must have been failing, which was really difficult as someone who I identify as sort of a high achiever. I'm able to be successful in every other area of my life. If I set goals, I'm able to achieve them. And it was really demoralizing and deflating. But I suppose in a way, it probably made me more successful in those other areas because I was able to control them and see those successes. So for me, how I entered into the world of obesity management. It's not a glamorous story at all. And I don't think a lot of the people who are on the call today, their stories are either. Like, this is real life. So I had been diagnosed with a genetic disorder where I had to have my colon removed. And so I did that as a preventative surgery, and it didn't go well. So I ended up in the ICU and midline incision and a septic shock and all the things, ileostomy. So I had quite a few surgeries after that to reverse the ileostomy, to and then to reverse the hernia. So it was, the initial surgery, the emergency surgery, the ileostomy repair, and then I ended up with a hernia where the incision was. And the surgeons refused to fix the hernia that I guess they created with the incisions until I got my weight under control. So at that point, I think I was just exacerbated and exhausted from the whole healthcare experience. I didn't want to have another surgery. I didn't want to have the preventative surgery in the first place. And I just sort of snapped and I just said, how do you expect me to do that? I didn't do this to myself. I can't just eat less and move more and drop weight like other people. So I can go and starve myself. I don't think that's going to be good for me for my enjoyment of my life. But is there another way that you expect me to do this? Like, you can't just send me away and say, lose 40 pounds and then we will fix you. And I can't think of any other condition or disease where a doctor would just say, go figure it out and come back once you've figured it out, and not given tools. So that's what I expected. Anyway, the conversation was not perfect, but it was definitely moving in the right direction with this surgeon. And he did explain to me that things have changed in the medical community, that obesity is a complex and chronic disease, that the way that we're built is 90% genetic. And there has been a lot of advancement in obesity medicine. And he wasn't planning to just send me away to figure it out. He was sending me to an obesity management clinic in Calgary where I received multifaceted care. So I had psychology, nutrition. I am on medication as well. It's a lifelong medication, just like I think any other medication that I'm on will be as well. And I don't see the difference. And that really opened my eyes. And even conversations with the nutritionist, for example, and the doctors, they would ask me things like, how many food rules do you have? And I would think to myself, I don't have any food rules. I eat healthy. And then we would unpack it. And I realized, wow, I am really conditioned by diet culture. So I'll stop there and hand it back to you, Lisa. I hope that answers your question. And sorry, I didn't introduce myself. I'm Lauren Gaetz. I'm from Calgary, Alberta. I'm a strategic development and marketing professional, and I'm also a human being living with obesity. So sorry about that.
Amazing.
Reversed order.
Oh my God. No stories allowed today. This is perfect. But I do want to challenge you to think about what would be one thing that you hope people take from today.
I apologize. Okay. What I would hope is, it's the topic, it's the title of our conversation right now, but obesity is not a behavior, right? So it is not something to be judged. It is not something within people's control. Like, fat is not a behavior. And so if we can, unpack the science and the facts, we can't debate facts. Facts are facts. And then we can look at things a little bit differently by the end of today and really look at obesity with a new lens of compassion and just realize that we are all human beings moving through this world, and we all deserve to be happy and healthy and get the care that we need, regardless of what that looks like. And I would hope that, folks on the call today who are medical professionals would take away maybe a couple of things that they might want to consider thinking about doing differently in the future. And I mean that in a really positive way, but it's having the courage to say, I didn't know, I know a lot, but I wasn't taught this in school, and I'm going to be humble, and I'm going to work with my patients, and I'm going to relearn some things. We all grew up in the same diet culture, regardless of your profession. So like, doctors aren't immune. And as patients, I'd love it if patients walked away saying, okay, I will try again, because I think we've been deflated a lot, and there's a fear and some healthcare avoidance. And, if we can have the courage to try again and be, leaning on supports like Obesity Canada, like us, I'm always, my proverbial door is open if anyone wants to talk to me. But have the courage to try again. And if the doctors can have the courage to be a bit humble, and then the patients can have the courage to be brave and try again, I think we can meet somewhere in the middle and collaborate together to build respectful relationships for mutual success. That's my hope.
Oh, I love it. I love all of this. Amazing. Thank you for sharing that. Ian, I know you have a long history as well and interesting stories to tell. So why don't you introduce people to the real you as well along the way and not just the director of advocacy version of you?
Yeah, thanks for that, Lisa. My name is Ian Patton. I'm the Director of Advocacy and Public Engagement for Obesity Canada. But I guess, like Lisa mentioned, I have a long history. I'm someone who's lived with obesity for most of my life, through childhood, through my adolescent, and into my adult years. Um, and for me, growing up as a the big kid in school, it was always something that I got teased, and that's a common thing. I got picked on by other kids, which was pretty common for people like myself who were a little bit different than the other kids around. For me, it was a little bit different though, in that I was always very active. I participated in a lot of sports, and sports where my size was actually an advantage. So that was always something that I was involved in, all the way through my university years. I was very active and very competitive with some of my sports. So, in my university years, I got into, I was wrestling for the university wrestling team. So I was being active. I was having practices, 2, 3 hours a day, every day, competing on the weekends. And so all through that time, I was also continually gaining weight and getting bigger and bigger. And so for someone who competes in wrestling, that meant that my weight cuts on a weekly basis also got bigger and bigger. So I was fluctuating my weight pretty regularly. My background and training is in kinesiology. So I was going through university for kinesiology and health science, and my PhD work kind of focused on obesity, which is how I got involved with Obesity Canada. So while I'm struggling with obesity and going through those periods of time where things were getting, I guess my health was getting impacted pretty significantly, I was also um, heavily involved in the obesity academic world, the science and understanding obesity and going to conferences and stuff like that. So it was a really interesting perspective that I was going through there. And I got really, really involved with Obesity Canada because I appreciated what they were trying to do and the work that was going on. And I was really interested in understanding the complexities of obesity. And, as I was going through my PhD, my project that I was working on looked at school-based physical activity and obesity. And I remember going to one of my first conferences thinking, it's a real simple problem. I'm a kinesiologist. Exercise is everything. All we need to do is get kids active in school, and all of a sudden the world will be better. And I'm going to win a bunch of awards because I'm going to secure everything. And it didn't work out that way. I learned very, very quickly that this is an issue that is very, very complex. And my little world of kinesiology and activity is just a very small piece of a very, very complex equation. And so I was very, very happy to be involved with Obesity Canada all through those years. For me, as far as obesity management, it was a pretty interesting experience because, like I mentioned, I was a kinesiologist. I, taught nutrition at college, and I was someone who knew a lot about this. But it wasn't something that I could solve on my own. So I continually failed my own obesity management efforts. I did all the diets and exercises and, the fad things that we've all tried time and time again. I've gained and lost, more than 50 pounds on several occasions. But it got to the point where I was 30 years old and I had a young family, and my health was really, really impacted. And I kind of had that wake up aha moment where I needed to do something to make a change and to be around for my kids when they grow up. And so I went through and I've gone through various different moments of obesity management, including bariatric surgery. I've done, worked with my mental health and cognitive behavioral therapy, and even, got into the medications and stuff like that. And so it's something that I have experience with all the different areas of obesity management that we're going to talk about today. And it was a real eye-opening experience for me, and something that I think it's important to understand that, different people are going to have different things that work for them at different times as well. So there's, times where, people might need a combination of obesity management, or, at some point, the obesity management or treatments that we have available might not be the right option for certain people. And that's okay as well. So, I think, I guess to Lisa's point about what I hope people take away from this conference, World Obesity Day, the kind of tagline that they have going on this year is changing perspectives. And I really hope that through this conference, through people watching some of the presentations today, that there's some perspectives that are changed. Some people who may not have understood what we know about obesity now, and are going to take something away, and that hopefully changes how they think and talk about obesity, whether that's a health professional who's going to maybe approach their appointments or their conversations with the people that they interact with at work a little bit differently, or if it's someone living with obesity who maybe changes a little bit their perspective about how they feel about themselves, or the conversations that they have with family and friends and coworkers and those sorts of things. So changing perspectives, I think, is part of the goal for today.
I totally agree. I think that's very well said. And yes, absolutely. I will share a little bit more about my story as well. As I mentioned earlier, my name is Lisa. I, like Lauren, I'm a marketer. I'm a lady that lives with obesity. I live in Vancouver, and I've spent a lot of my life struggling with my weight, and really blaming myself for that struggle a lot as well. And as I mentioned earlier, in 2017, I had the opportunity to bump into Obesity Canada for the first time by attending a session by Dr. Arya Sharma, who was our former scientific director. And I remember seeing this slide on the screen that was this really overwhelming, I think they call it even the spaghetti map, Ian. I think that's what it's often referred to as. And it really was showing all the different factors that go into what creates somebody living with obesity. And to see all of these factors and then this little tiny dot in the middle that was me, I was like, okay, I was never going to get there on a treadmill. This is interesting. And it really helped me, exactly that, change my perspective, and really relieve myself of the oppressive belief that had been my choices and my behaviors that were really solely and the only reason that this was happening in my life. And I really think letting go of that misinformation and belief was a huge part of my trajectory. I had had bariatric surgery at that point, and I had felt like a failure because in my mind it didn't go as planned. And I now understand I'm not going to be the only one that might happen to or has happened to. And that treatment for a chronic disease doesn't really have a finish line. To your point, Lauren, this is going to be what I navigate the rest of my life with as well. And the medications and things that I'm on, I need to think of them kind of like my eyeglasses. I don't take my glasses off at the end of the day and go, why didn't my eyes get smarter? I've accepted this. I've worn these since I was 5, and I don't beat myself up about it. And I'm happy that I am in a place now that I can feel that same way about medications that help me with my obesity and managing my weight. So I think that's a really big thing. And what I really hope people take away from today is, as much as this is complex, it doesn't need to be complicated. And there are solutions, there are options, and there's hope. That's really what I want people to feel. And that might be me projecting, because I felt very hopeless for a really long time. And I think that really stymies anybody from taking any action, whether that's deciding to play on the floor with my kids or going for that walk or asking for help. So I want people to walk away with a bit of hope today as well. I know a lot of the information today, really all of the information, is rooted in what are called the clinical practice guidelines for treating obesity. And Obesity Canada released these back in 2020, I believe it was, Ian, that these were rolled out. These have been a real revolution, and really the more human way of expressing, and Ian, you can correct me if I'm wrong in this, kind of what these clinical practice guidelines are. The way I look at them are kind of the rules of engagement of how doctors and patients, as Lauren keeps mentioning as well, this needs to be a collaborative effort, kind of the rules of engagement of how people can get treatment for obesity and seek treatment. Would that be a fair kind of summary, Ian? And maybe you can kind of help us understand the clinical practice guidelines in a little snapshot.
Yeah, absolutely. Your summary is fair. That's a good description of what they are. So the clinical practice guidelines, typically for any condition, clinical practice guidelines are tools used generally by health professionals. It's not something that the general public or patients are usually going and looking up very often themselves. But these clinical practice guidelines that we published in 2020 were a bit of a game changer, and they've actually been adapted internationally now. They are viewed as kind of a almost a gold standard type thing, because they are the most current, up-to-date evidence of what we have for obesity management, and they are very comprehensive. They were the first guidelines to include an entire chapter on weight bias, which is an important part of our journeys and what we go through, and the impact that can have on an individual's health. I think what's really interesting about these guidelines is that we wanted to make sure that they were something that the patients themselves could use kind of with a bottom-up approach, where they understand the guidelines, they understand the information, the recommendations that are in there, and they could be taking that to their health professionals to have conversations with their health professionals. So it's not just a top-down approach. We can kind of get that knowledge translation from evidence to practice happening a little bit faster. Which is why we have events like today, this conference, where we're going to be talking about these pillars of obesity management. So we're going to have talks about medical nutrition therapy, physical activity, psychological interventions like cognitive behavioral therapy. And then we're going to talk about pharmacotherapy and surgery and how all these things fit together, which is, coming straight out of the information that's available in the guidelines.
Thank you. That's awesome. And I think, for me, when I look at them as a list like that, where it's, medical nutrition therapy, physical activity, psychological interventions, and pharmacotherapy and surgery, that feels like a nice, tidy list. And I think we've all already reflected this as well. It doesn't always come in that tidy tick box fashion. You're going to have to go from A to B and maybe back to C and then down to D again, all those kinds of moments. So I think that that's going to be a good takeaway for people today as well. And I think you tripped on a buzzword, and I'm mindful of time, but I want to go here because I want us to get just a little bit spicy for a second as well. Because I think it was, you mentioned that pharmacotherapy and surgery aspect. And oh my goodness, we know that there has been a lot in the news lately around Ozempic in particular. And I know the three of us were just chatting about how much Ozempic has been in the media, and it got spicy when just the three of us were talking. So I kind of want to go there for a moment. Ian, I know you and I have stumped on the hill making efforts to help people understand obesity as a disease and getting coverage for this medication. And now just look at us. Look at what has happened. The genie shoe's out of the bottle. Luckily, we are partnered with Obesity Canada. We get to live in Canada. A lot of the misinformation and noise is more US centered. But Ian, maybe can you give us a little context? I know you just did a radio piece even talking a little bit about obesity in the news and those kinds of moments. Just to give us a little temperature on your earth before we go over to Lauren, because I know she's got very spicy thoughts on this moment as well.
Yeah, I think it's been an interesting period of time for us people who are in this advocacy world, because we've been working so hard to change that perspective and get that, understanding of obesity as a chronic disease out there and in the world. And now you're having more high profile things happening. So, the information that's happening with the medications like semaglutide down in the States, or, even up here in Canada, there's lots of media attention that's being placed on that, or the American pediatric guidelines that recently came out, or just this week was another big story came out from World Obesity Federation and their Atlas report, which had some pretty shocking headlines that got a lot of attention and is drawing a lot of media attention now. And I think all of that is great because it's allowed us to have a lot more productive conversations. And I think there's a lot of people that are more open to having those conversations than what we've seen in the past. But at the same time, I think it's also stirring up some of those old narratives and beliefs and misinformation. And those are kind of making a final stand to push back against some of this change that's happening fairly rapidly in our understanding of obesity. So it's an interesting period of time to be involved in this work.
Mm-hmm. I know Lauren and I often talk and share a lot of frustration sometimes and consternation about finding a balance between, the body positivity, wanting to embrace body diversity, the noise that's out in the world. You and I have talked about this, Lauren. Share your thoughts on this kind of interesting moment that we're kind of in with obesity and
Yeah.
noise.
Yeah, I mean, on one hand, it's great. Like we've come, like you said, Ian, we've come a long way. So there's more out there, there's more in the media. So, we've done our job in a sense to bring a wider platform to this discussion. So that's great. But there is a lot of sort of misinformation being put out there. And yes, it is a lot of it is in the United States focused. What I'm referring to is around, celebrities taking Ozempic to lose the last 10 pounds. And they're already, very thin, naturally blessed genetically humans. And so they're taking it to lose 10 pounds for the red carpet or for a movie role or something like that. And I think what frustrates me about that is it's changing the narrative to be this sort of silver bullet for people who are just looking to lose a few pounds, and that you can just do that and it's easy and you don't have to think about anything else. And I think that's just so very wrong. It also wasn't intended to be dabbled with that way. And I think, shame on the pharmacists and the doctors who are giving it to people who don't need it. I would never I'm too risk averse. Like I would never want to go to a pharmacy and be like, hey, I think, I don't have this disease, but I think I'm just going to go see what this medication does for me. Like it just seems very bizarre to me if you're not suffering from the chronic disease of obesity, that you would want to go and mess with a medication. With all medications, there are risks. And in Canada, I think we do a good job of weighing the risks versus the benefits. I think the doctors do a good job. And if a doctor decides that this is a good solution or something in the toolkit that you should try, I think that's great. But they're looking at it from, okay, there are risks to this, and we think that the risks will outweigh or the benefits will outweigh the risks. So I think there's a narrative that's going on where it's like we're 85% of the way there, Lisa, I think we were saying, but there's a piece of it that's just not true. And a lot of hype around, people saying that it's going to give cancer or it's this easy, quick fix. And yeah, I'm struggling with it a little bit. Over to you, Lisa.
Over to me. I don't have solutions either, but I totally agree. I think it's, as you're a marketer as well, we understand this moment. I've been in PR. There's no such thing as bad exposure. Sure. And I enjoy the conversations that are happening and the ability to right align some of those conversations. But it is a little disheartening because I think the root of people understanding that obesity as a chronic disease is getting a little lost in the sauce right now. And that, this really is an option, but it also, to your point, and very well said, Lauren, is not a silver bullet. What works for me, even in this medical realm, might not work for the next person. We know a lot more than we did, but there's still a lot we don't understand or know yet around obesity and managing obesity. But we've got some great places for people to start. We've got some right conversations to start having with people. And I think that's really the most important thing that I want everyone to take away from today as well. So yeah, I think it's interesting, and that belief that people are taking drugs from people who need it, from diabetics, those kinds of things. I just want everybody here to understand that is a very US centric moment. Canada, we're a bit more measured. My real fight in Canada is how can we get these medications covered? either federally, provincially, or privately, so that more people can gain access to them. Because I think it can relieve a lot of strain in a lot of other places on the surgical front. And I know there are so many of us out there seeking care and community as well. I don't want this to be a louder thing where people think they can go get that silver bullet and stay in isolation, because I really believe community is such an important part of what we're doing and how we can make this impact with people. So I want to say thank you a lot to both of you for everything that you do. But really coming here today and sharing these pieces of your story, I know that is not an easy thing to do in this world. And it takes courage. And as you and I have also spoken about, Lauren, courage begets courage. So I appreciate you shouting that out as well. And that it is going to be collaborative, that this does need to take a team of humans, and that we are really excited to try and connect dots today. But any last thoughts from either of you as we kind of reach time? Anything else you want to share or make sure that people hear loudly today? Open for that.
Well, I think from my perspective, I think, we've said a lot of the things that we wanted to hear. I think when it comes to access to treatments, that's something, it's not just the medications. Medications are part of it, and getting coverage for that is important. But, something Obesity Canada has worked on and is always working on is access to all treatments. So that means, better access to doctors who've been trained and understand obesity, and better access to bariatric surgery, or better access to the mental health aspect of things. So it's like you said, it's comprehensive, and we need all of those things.
Mm-hmm. And I think, I feel very grateful that I'm in a position that I can afford my medication. My dream is that it is covered at some point, and that more people can get access to that tool, and affordability isn't a barrier. So that would be a dream in the future for me.
Oh, it looks like we've lost Lisa momentarily. Oh, here she's jumping back in. So give her a second here to see if she's able to jump on.
I am so sorry, everyone. I'm back. That was so dramatic. I am so sorry, everybody. Jinkies, Batman. I'm back. Apologies. Thank you, guys. I definitely managed to eat that last minute in our section, but thank you guys for kicking off today. This was fantastic, and I think a really great way to start. I always enjoy that Obesity Canada has a long history of starting things with the patient perspective, because we really are what it's all about, and why people do the work that they do in this space. So thank you both. Have a great rest of today. I'm sure you'll be around. Big love. I can't wait to see you guys again soon. And with that, I think we can move to our next topic, which is going to be another really great one for everybody to take part in today.